Everybody there that's out there, I wanted to talk to you about the foot rot approach to treatment because there is a lot of information and it's currently changing right now on how to approach foot rot. And I think I'm digging my heels in and I'm kind of in the old school way of doing it. But just to kind of let you know, and many of you may approach this before this way, when I'm treating foot rot in a herd, especially in a herd that has had it for a while. This pathogen is in the soil. I mean, it's in the bedding. It is everywhere. And and even without wet conditions, I should clarify I mentioned wet conditions and a lot of rain and things like that earlier. Squishy ground in the spring when the snow's melting and it's just really wet. That is prime time to get a foot rot outbreak. However, you can have dry conditions, and if it's endemic in the soil there and you have had generations of sheep and goats there. You can have foot rot anywhere in any conditions if it's endemic there in the soil. Okay, it's contagious. However, the one good thing that you can remember about the life cycle, the susceptibility of this pathogen, is that it's typically when it's not embedded in anaerobic necrotic tissue, when it is exposed to oxygen and when it's exposed to sunlight and the elements, it's not a very strong pathogen. It typically only lasts in the environment, even with moisture helping it, typically only lasts a few days. And most researchers throughout the last several decades have found that foot rot typically, if you can go 2 weeks without an animal on your property, most of the viable bacteria in the soil there do die or they become non-viable. And so during my veterinary school career and early career as a food animal veterinarian, I always went by what I was taught, which is when trying to incorporate a treatment program, if you can rotate the animals, if you have a few pastures and you can rotate them between pastures such that they're going on to new pasture that hasn't had sheep or goats on it in the last 2 weeks, typically you're moving them onto effectively clean pasture or pasture with significantly reduced pathogen load there. Now, there's some research lately in the last few years that shows under the right conditions with moisture and debris and vegetative or decaying material there, that the pathogen can survive in the environment for up to a month or more. Even 40 days has been found. Knock on wood, I haven't found that myself yet. Typically, I've found that if you use the approach I'm about to tell you, I've had very good success with being able to clear up a herd or flock of foot rot, which is a nice thing to do. It takes a lot of work and a lot of time, but it can be done. Okay, so that's the first thing I wanted to tell you about the time and the exposure of this animal in the environment. The second thing I wanted to talk to you about really quickly is foot trimming. I have always felt, in my opinion, when treating ungulates with an interdigital infection, that the first thing you should do is to clean and debride the foot, open up the interdigital space, get some oxygen in there and some air, let it dry out, and trim the foot if it's overgrown. If you have overgrowth at the white line or the edge of the hoof, and typically in sheep and goats, you'll see sometimes they'll get so overgrown it will curl over, and it will create this little capsule of nasty black, like anaerobic festering material. You've all seen that when you've trimmed sheep and goats' feet, when you go to pick out between the toes, and especially in the white line. You've seen this when you're trimming horses' feet too, that black, dense, necrotic, smelly debris. In my mind, that all needs to be brushed out of there, cleaned out of there. Trim the overgrowth of the foot. Don't allow any any pockets. And also, I'll take a little brush or like a little wire brush or a hoof pick with a brush, and I'll make sure that that is cleaned out of there. All of your equipment should be disinfected when you're trimming animals with foot rot. So recently, in the last few years, there's been some research to show in some of the larger flocks in other countries that actually they've found that compared trimming feet to non-trimming feet when incorporating a foot rot prevention program, and they found that in some cases, not trimming the feet actually was better results and faster recovery of some animals and flocks from foot rot. And I've racked my brain about this. I've talked with other clinicians, and there are clinicians that because of this research that do choose not to trim the animal's feet when treating an outbreak of foot rot. What I've found in going through the methods and materials and trying to review the specifics of those conditions and those recommendations that were made, what I've found is I think it really matters how you trim the feet. I think it really matters how aggressive you are trimming the feet. If you trim the feet. And some of the authors talk about this. When you trim the feet, if you're overly aggressive and you trim back such that you sometimes nick the animal or get the quick or go too deep in the white line or go down into the interdigital space on the inside of that corium barrier between dermis and hoof wall, if you're too aggressive, that is essentially opening, even on a level you can't see, a small a pathway there, like a microabrasion or a little scratch or wound. If you're being too aggressive and causing microabrasions or even trimming just too far back to the lamina, that leaves an open wound and can certainly not only just from your foot trimming harm the animal, but it also can create a more rapid way of spreading foot rot through the herd, especially if you don't disinfect your instruments between animals. I've found that a superficial foot trim, just trimming the edges of the overgrowth of the feet. I'm going to kind of advance here just to show you a picture. It's a picture of just basics on my students as we trim feet, a super basic hoof trim there. I could be more aggressive and really dig out the inner white line and where the two toes come together. I could certainly be aggressive and take off the heel more there. That's typical for me for doing the toe. I just want to see the white line. I don't want to penetrate into it, but I've seen many people trimming feet and they're fast. They have to do a lot of them and they're very aggressive. And I think that over trimming or trimming too short can be part of why, when you're in the face of an infectious pathogen that's contagious between animals and looking for exposed tissue, I think that could be part of the reason why some research shows that foot trimming can actually be detrimental and it can promote the spread of foot rot. I always trim the feet. I recommend trimming the feet once at the beginning of the prevention program when you're going to start to treat these animals and rotate them. I also recommend for the ones that I find that are infected, I actually do a quick betadine scrub or a disinfectant scrub deep up in there, and I kind of debride that little tissue. It takes time, but I find that goes a long way. So I know I just spent a long time harping on that, but just because there's a lot of confusing data out about trimming feet in the face of a foot rot outbreak, I didn't want you to be confused. I do recommend it. I do recommend it be done by an experienced person with care, but I don't want you to be confused if you see that there's research out there that says the opposite of what I actually do. And so it's just a practitioner's approach on how to balance all of that. Do not over trim. Okay, so here's just a quick, many of you are very familiar with how to trim feet, and so we don't need to talk about that. That's more of an introductory level course, but how you trim the feet can really affect this in this situation. So here are some of the foot bath recipes. I'll provide this handout with foot baths that we recommend: zinc sulfate, formalin if you're brave enough. Formalin is actually an excellent foot bath. It kills pathogens. The problem is it's explosive, it's caustic, and it is dangerous. If you get it in your eyes or if you have pets walking around or anything like that, it's very effective, but it does also dry the feet. It makes them very, very hard, so they're hard to trim when they've been disinfected with formalin foot baths, but it's very effective. Zinc sulfate, probably the most common one that I use. There's your recipe there, 10 to 15%. Ideally, when we're talking about foot baths and small ruminants, you guys, in an ideal world, if you're getting true penetration of these foot baths, you would have each sheep stand in the foot bath for 30 minutes, 3 to 4 times a week, right? But that is probably not going to happen anywhere that I know of. I'm just letting you know that in an ideal world, the way the product is most effective and labeled, that is what you would do. There's almost no way I know of, unless they're sheep animals, that you can tie on a halter and stand there in a foot bath, and it would just take all day. But just so you're aware that when people run sheep through a foot bath and they splash in and splash out and they barely have enough time in there to get their feet wet, just so you're aware that the efficacy of that is going to go down linearly with the reduction in contact time with this foot bath. So if there's a way to get the sheep to stand there for several minutes and pause them in a row, that's the most effective way to do that, and then allow them to dry before you turn them out on pasture. So that sounds like a process, and it is, and anybody here who owns sheep and goats knows that's probably a nightmare, but I'm just trying to frame in your mind so you understand the ideal goal of how to treat this and why sometimes foot baths fail. And one of them is, the reason is contact time. The other one is contamination with organic material, urine and feces, and everything else getting in there does deactivate a lot of these foot baths, okay? Copper sulfate, very common foot bath use, especially in the cattle world, but be cautious with sheep. When you have copper sulfate, this copper will build up in the soil, especially when you have to dump and change your foot baths. So it's not used as commonly in sheep. It can be used in goats and cattle. But typically I start with zinc sulfate as my most common beginning foot bath. Okay, foot bath management. There's some tricks to getting sheep to walk through there because they often don't want to walk through there. Here's an image of just running some animals through a foot bath. And you can decide how you want to do it. There's no people standing there, but in reality, when we're running animals through a foot bath, there need to be people there feeding them in, holding them, or keeping them nearby there, letting them go individually, and just monitoring it so it's not complete chaos. They don't all walk single file in there like that. Here's a system that one of my clients in a former practice in another state had set up. It doesn't look like much, but it works, and it keeps them standing there, and he can drop down the gate in front of and behind the sheep so they can stand there as long as he or she wants to keep them in there. So that whatever works there works well. The only problem is that's a little hard to get into and to dump out and clean those foot bath bins. But yeah, it's finding a way that you can get them to go through single file and stand in there for a few minutes is very useful. Here's a bovine foot bath at one of my dairy herds, just so you guys can see the difference. That blue powder is copper sulfate. Okay, so foot rot. Vaccination, I'm not going to spend a whole lot of time on vaccination. There is a vaccination available for it. I typically do not, again, for this particular disease, it's not one of my common core vaccines, foot rot. It's there. An example would be Fusogard, a very common commercially known vaccine. Can be used in herds where it's endemic, and it can reduce clinical signs. It's not going to prevent infection, but it's a series of shots initially, then a booster. It is a lot of shots, but it can help take the edge off if you're having an outbreak. But for me, when I have a herd or flock having an outbreak, I typically want to go the next route, which is trying to actually, if possible, try to actually clear it up if the owner has the management and the facilities to do so. I would rely on vaccination as an end stage salvage procedure to reduce clinical signs and just take away the effect of this, reduce the effect of this foot rot on the animals if it couldn't be removed from the herd. Okay, so quickly, eradication and control. Keep in mind that 2-week exposure period, okay? Eradication from a flock is possible, but it takes a long time, and sometimes you find yourself starting over, but you can get this done. We did this with the flock at New Bolton Center. Actually, it was before I was a veterinarian there at University of Pennsylvania. Dr. Wendy Freeman, the small ruminant veterinarian before me there in field service, did this. But essentially starts out with dividing your flock into clean and affected groups. So you have to go through and do what I just did. Catch up every animal and assess every animal's feet. Look for lameness, look for lesions between the toes, and start out by running everybody through a foot bath. Even clean, the ones you think are not showing signs or lameness or interdigital lesions, everybody gets a foot bath at first, okay? Then, as you've separated them into clean and contaminated, or clean and affected, you start working on the affected group. And this is the part that takes cycle after cycle after cycle for weeks, but it can be done. Basically, your clean group you set off somewhere at a clean pasture out of the way where they're not going to get recontaminated by the contaminated group. And then the contaminated group, you basically want to start working with them. That means running them through a foot bath at least 3 times a week for 2 to 3 weeks. During that time, every single time you run them through, you're closely inspecting them, looking for lesions and watching for lameness. As you've trimmed them and run them through a foot bath, that action alone is going to cure many of these animals. Okay, most of them, if they have mild foot scald or superficial foot rot, just one time getting their foot trimmed and going through a foot bath, that alone, within a few days, they'll stop being lame, and you can detect them, score them, and separate them into a treated pen. Typically, I like to have 3 pens here. The clean pen, the animals that never showed signs of foot rot, the animals that have showed signs of foot rot but have been recovered but may recur, okay, and then you have your contaminated animals that are still positive or showing clinical signs, and you're still working with them. So now, as you run this foot bath and trim and monitor and keep assessing these animals, scoring them for lameness, looking for the interdigital lesions, you continuously, each round, remove a few animals as they cure and get better into your cured pasture, your resolved pasture, or whatever you want to call it. Now, if an animal in that cured pasture comes up lame again, A lot of research, Michigan State and other universities say that even if they've been cured and appear to be cured and they come up not lame and it looks like you've resolved them, when they come up lame again, that they should be culled. A lot of places say you should just cull that animal immediately right there. I typically, from older research and stuff, I tend to be a little old school, and I will often give them a second chance. I will run them through the foot bath again. I'll assess them in an individual basis. If it's a nice animal and it looks like maybe it just one treatment wasn't enough. I know that sometimes one treatment isn't enough. So I'll run them through again and give them the round of treatments again. Also, you can use systemic antibiotics on individual animals if you need to, if you feel like they have bad enough lesions or they need to be cleared up from deep wounds or deep infections. But if I resolve the animal a second time and they come up a third time, that's to me three strikes, you're out, and you get culled from the flock. That is likely to be a carrier animal, long-term carrier animal. And I'll give them up to a month or two of this cycle before I decide this. Depends on how fast they come up sick again. But so this continuous pattern, I hope what I'm laying out for you makes sense. 3 separate pastures at least, the more the better. Animals in a completely clean pen, a clean, recently cured pen, and then the animals that are still in the affected pen that you're working on. And things don't always go according to textbook. You may have animals that were out in the completely clean pen and they're fine. They're the ones you set to the side, and you're working on these other ones in the affected pen. And all of a sudden, a few weeks in, one animal over in the clean pen pops up lame, and you're like, oh, come on. So you got to start from scratch. You got to get that particular animal back, put them through the system. This program requires intensive care, but within the year, you can resolve this problem in most cases. And that's nice compared to looking at decades of lameness and culls and poor performance and poor growth rates and poor fertility. All these things can come from infectious foot disease. So anyway, it can be done. And if you guys ever have a question, you can give me a buzz. I mean, it's something that can be toyed around with. Here's our flock that was at New Bolton Center. This picture's, this picture's probably 25 years old. There are the ewes there laying around back there on Bird Ave behind New Bolton Center. New Bolton Center is the large animal campus at University of Pennsylvania, the veterinary school. Okay, ORF, here's another very, very common one. Very, very common one. You guys are probably all familiar with it. This is a zoonotic disease. I'll start off with saying that. Our veterinary students every year and the students that I have ride with me, I always tell them to wear gloves. Do not kiss your sheep and goats on the nose, okay? If you have a flock that is either unknown or is known to have ORF, be careful with open abrasions, cuticle cuts, and certainly anything around your face, eyes, or mucous membranes. It's not highly pathogenic to people, but I definitely know people that have gotten cold sores, blisters, and lesions from this at the university and from working with sheep. Also, people at auctions that are working with these sheep can get lesions, and you have to remember that it is zoonotic, mildly zoonotic agent. It's a pox virus. It is highly contagious, and it is those scabs that form on those blisters and vesicles that are the highly contagious material that contaminate the environment. This is extremely common disease. You guys are probably all very familiar with it, contagious ecthyma or orth. Many statistics have shown it's present in 40% of operations, and definitely when we do these surveys, it is something that if flocks are negative, they certainly know some nearby that are positive. So this is something that you're going to see very commonly. It can be painful. It can cause lambs and kids it can be so painful and can interfere with nursing. It can cause some lambs and kids to waste away or starve. It can cause mastitis in ewes if the lambs are nursing on them. Typically high morbidity, low mortality, generally very self-limiting. Something to remember with this disease. The lesions typically, if you leave the animal alone and it has a competent immune system, the lesions typically regress in about 3 weeks. I give them 4 weeks just to make sure. Occasionally you can have bizarre and rare, but very aggressive forms of ORF that will cause what we call malignant ORF, which is a excessively proliferative production of exuberant granulation tissue and scabs, and that will not be your typical case of ORF that is resolved in 3 weeks. But most of your sheep and goats will resolve this if left alone with no treatments. This will kind of essentially burn through your flock like a typical virus infection, and at the end, they will have some temporary immunity to this and they will have no lesions. But they certainly can still be carriers and can expose naive animals. But the lesions can resolve in about 3 weeks. Just remember, this can spread directly or indirectly. This does not require a vector. This is one of the most contagious direct animal-to-animal diseases I work with. There are no treatments, and remember, do not pick and debride those scabs. If you aggressively soak, debride, scrape, or pick those scabs, that causes actually a aggressive proliferative granulation tissue response and more scabbing, and it actually prolongs the disease and causes more tissue damage. So this is one of the few diseases I don't debride a wound. I leave that scab on there and I completely leave it alone, which sounds counterintuitive, but I isolate the animal and just give it time, make sure it can still eat and drink, but I get it away from everybody else and I just let the virus run its course. Certainly, if this is a herd that ORF was not present, you could cull the animal as well too. So diagnosis is typically done by you, the veterinarian. These are classic lesions that you look at and you see, and you can diagnose it on site. Remember though, and this is kind of important for the theme that Dr. Walsh is going to talk about, when you're examining animals for possibly reportable animal diseases, in the very, very earliest stage of ORF, we rarely see it in this phase, but in the very, very earliest stage of ORF, where you see these crusts, before the crusts are often little ulcers or raw wounds there that quickly within a day or two become crusty and have a different appearance. But if you do find a naive herd going through an ORF outbreak, you may find some blisters or mild ulcers or ulcerations or what look like vesicles on these small ruminants. And if that happens, if you have any question whatsoever, you should immediately contact your state animal health official and or your USDA animal veterinarian in charge, AVIC. Just like we all took the accreditation courses on how to start and notify the appropriate authorities if you think you have something that's even remotely suspicious of a possible vesicular or foreign animal disease, it's better to just call us and ask. Dr. Crawford and I, he's the state veterinarian here in New Hampshire, we get calls 2-3 times a year from veterinarians that are looking at sheep or goats, and there's it usually ends up being in the end, when we diagnose it, ends up being an ORF infection, but they had mysterious looking or questionable oral lesions around the nose or lips, and you should be aware of that the high risk, the low risk but high significance of that potentially being a foreign animal disease. Okay, so just want to say that. If it's in the crusty phase and this is in a herd with a clear history or background, and you feel confident, you as a veterinarian, that these are crusty lesions and this is contagious eczema, then it's up to you as an accredited veterinarian to use your judgment and decide if you think if this is an issue that needs to be reported. Now, with ORF, when you're isolating them, it's going to come up again. This seems to be a theme I keep bringing up with you with every one of these infectious agents. Vaccination. There is a vaccination out there. Okay, there is a vaccine out there. Again, I may use, as I've told you, the CL, the caseous lymphitis vaccine. I've used that before. I may use the Fusobacterium vaccine and Bacteroides or Diclobacter vaccine for foot rot. I've used that before. I tend to try to manage my way through and prevent rather than doing the vaccination, but I will use those vaccines. Here's a vaccine I have used very little. I've hardly ever used this vaccine. I'm not saying it's not recommended. It's just I really try to test, call, identify. This is a live virulent virus, this vaccine, and if you vaccinate your herd, you're essentially giving them the true infection. It's attenuated a little bit, but it can cause disease, and it will cause disease if you start vaccinating a flock or a herd that is naive. Okay, so this is a vaccine that is not to be taken lightly, and to make sure you know what you're dealing with. Getting back real quick, I did gloss over under diagnosis. I talked about diagnosing things by clinical signs. If there's a flock or herd that has never had ORF, or they recently had an addition of an animal that could suggest by the history that it could have brought ORF onto the flock or herd, and it's showing those signs, you certainly can diagnose this with molecular testing. You can send in a swab of this, PCR, into your local lab. I've sent this into the Paddles, Pennsylvania Area Diagnostic Lab. You can also send this into Cornell, the AHDC lab. Our local laboratory, New Hampshire Veterinary Diagnostic Lab, and I think your main diagnostic laboratory, I don't want to speak for them. I don't think that we can diagnose and run these tests in our local laboratories, but we can immediately forward it on to the appropriate labs Actually, anybody out there that is from the main diagnostic laboratory, if you happen to know the answer to that, I'd love that. Okay, looks like, thank you, Anne, does not provide that test. Okay. Quick question I just saw pop up. Any time frame for natural immunity? Ooh, and it disappeared. Any time frame for natural immunity from ORF? We're going to talk about that in a second. I think the rest was the question on ORF. It flashed up to me there, and I didn't see the second half. Not very, okay, thank you, yes. Send sample to Cornell. Okay, bovine parapox virus. Okay, it looks like in the state of Maine, where you guys are at, it's very similar to us here, and that as an accredited veterinarian, as a practicing veterinarian, you can send this sample directly to Cornell or to your referral lab, Pennsylvania, Florida, Texas A&M, and they can test this. Or if you bring this to your local diagnostic lab, they can help you package and forward this on to the appropriate laboratory. Moving on with the other question about antibody prevention here. I'm sorry, not antibody protection. So unfortunately, the antibody protection that you get from infection is not long lasting. It's not very effective. Also, there's no colostral immunity that's passed from the dam to the neonates. That's why neonatal kids and lambs can get so affected. Young animals typically are most affected by this ORF, contagious ecthyma. So it's a very short-living antibody protection from natural infection. But I will say that typically it is young animals that are completely naive that mostly get this infection. As far as from the vaccine, maybe you were asking me that. The vaccine, as far as I know, is an annual series. I'm not positive on the duration of immunity you get from vaccination. That's actually an excellent question. And I can get back to you on that. That's a very good question, duration of immunity from vaccination. So just remember that this virus contaminates the premises once it's there. This is not like foot rot. Foot rot, once it's there, it is not necessarily there to stay. With ORF, once you have animals there and they've been shedding scabs, this is a virus that is likely to be present on your premises and contaminate your premises for a very long time. Okay, and then down here, sorry, I see here in my slide. So immunity from vaccination, there answers my question. It looks like it lasts several years. I know that with some of the newer vaccines, there's a more frequent regimen of vaccination that doesn't last several years, but you would vaccinate annually, where the vaccine duration of immunity is less than a year. So it looks like with a variety of products available, you can choose your product for vaccination, but it looks like you can get several years of vaccination immunity out of that. Okay, moving on. So really quick, and just a slide or two, I just want to mention to you guys blue tongue, something that's not super common, something that's hopefully you will never see in practice. Hopefully I will never see in practice, but I've been giving the blue tongue lectures at University of Pennsylvania, for those of you who are VMDs out there, since I graduated. I've been giving blue tongue lectures there since 2003. And just the time period and the change in my lectures on this disease within 20 years is amazing. This disease and its spread across the world with changes in climate and increasing temperatures and a broader range of the vector, this disease is spreading to new countries. Every single year I have to review a new list of countries and latitudes and longitudes that this vaccine is present in. And it is certainly present in the Americas. It's present in the United States. We have our own endemic strains, and each country seems to have it. But the reason it's important is because, hopefully you won't see it. I'm going to advance right here. Here, see this map of the United States. It has been present over the course of decades and decades in multiple states. It tends to live in areas that are vector friendly. Fortunately, in New England, we are still, hopefully we will remain, but we are still relatively non-vector friendly, and we don't get a lot of this disease, blue tongue, in New England, but everybody here should be aware of it. It's a very aggressive disease that causes a very, very sick animal, typically infects sheep much more than cattle or goats. It is certainly reportable if you saw signs of what you thought was blue tongue. And this arbovirus, there are many, many strains of it around the world, and it tends to adapt to its host and adapt to its region. And it can become endemic in an area. The biting midge, Culicoides, our favorite vector, is the vector that spreads this. So this requires an intermediate vector. It is not primarily spread by direct contact amongst the herd or flock. And it's relatively uncommon to absent up here, but we need to be aware of it because it is spreading. Every year, I add new states onto my lecture and new countries that this virus is present in or cases have been identified in. It's also been identified now in white-tailed deer in New Jersey and in wildlife such as bighorn sheep and others. So there certainly can be a wildlife vector, which is very important here in the United States and other countries. So this is something that I hope we can continuously say next year and the year after that we don't have it, but every small ruminant and large animal veterinarian should be aware of it. Typically, it causes an extremely sick animal, high fever. It can certainly cause oral ulcerations and erosions, which should be an immediate red flag to you to call your state animal health official. Salivation from the pain, profuse nasal discharge, conjunctivitis. These animals have a low white blood cell. It's a massive global systemic immune response that this animal's launching. Abortions and morbidity and mortality can vary, but typically there's high morbidity, relatively low mortality depending on the immune status of the flock. It literally looks like this lamb or this goat or this kid or whatever animal's being affected, it looks like somebody has taken a hot frying pan and just burned the poor animal's muzzle. They get blisters. It looks like a sunburn with blisters and ulcerations and swelling and cyanosis of the tongue. And just something to keep in mind. If you see a sudden outbreak of disease that has high morbidity spreading between animals and appears to be causing systemically sick animals with any kind of oral ulcerations, you would call your state animal health official anyway. But blue tongue, this is not what we consider a foreign animal disease. It's here in the United States. It's just not in our region. So it's something for you to keep an eye on because it is gradually spreading even within our nation. And here's a picture of an animal with inflamed coronary bands and lameness. It can affect their feet. So diagnosis, first, you would call your state animal health official, and the local foreign animal disease diagnostician would be worrying about the diagnosis and quarantine and all these things. But certainly there's plenty of diagnostics available, and the students, I talk a lot about the difference between individual pathogen detection and serology and what you would do in an outbreak. There was a JAVMA article in, I believe, 2010 describing an outbreak in 2007 that goes from beginning to end. Just one example out in Wyoming in the I think it's the Bighorn Sheep Valley, I think, where they had an outbreak in an area that was previously naive. And they did a full write-up from beginning to end on how they worked on serology with their state animal health official and diagnosed it within that population. So prevention for you is early recognition if something doesn't look right and just being aware of this disease because it's a worldwide problem and it's a problem for us too. And certainly here are some of your other differentials, some of the major reportable differentials that we've talked about. Also, ORF and photosensitization, two non-reportable diseases, or certainly not to the level of program or foreign animal disease level diseases that you would have to keep in your mind as well when seeing an animal with these kind of clinical signs. Just what happens when you Google blue tongue. That's what you get for images. And a funny little clip here over in the UK, the Ministry of Agriculture, and they're looking for animals to depopulate. And these two sheep give the lollipop to this guy here, and he's like, "Oh, thank you guys for that delicious blueberry lollipop," and they're laughing. So anyway, silly humor. Okay, bouncing on. I'm just let me know. I have 12:28. If you guys have questions, certainly Michelle or Carol can interrupt me. I'm going to kind of keep going, and we will have another 10, 15 minutes with, and then we'll ask questions. So ringworm, very common, very straightforward. I think you're all pretty familiar with this fungal disease. It's very common in livestock, and this can be a very common reason why you would refuse an animal for a health certificate or a certificate of veterinary inspection for interstate travel, or certainly even to just go locally to the fair. This is a contagious infectious disease and it's zoonotic. There's no way if an animal has ringworm, you should be signing any kind of health certificate or CVI, okay? And I have been there myself with all of you where the client's, daughter is raising this 4-H sheep and she's so excited and she's been working on training it for months. and then they go and bring in some other animal, or somehow they bring it to a sheep, uh, another sheep farm for a show, or somehow the sheep comes home and a few weeks later it starts showing these ring-like proliferative crusty patches, and it can be on the face or ears or neck like that. And then, unfortunately, and then you can do diagnostics or you can diagnose it by clinical signs, but they want to go to the fair and they want you as the veterinarian to sign a health certificate. Certainly doesn't look like little Wooly the sheep is that sick. She's eating. Why can't you sign a health certificate, Mr. Veterinarian or Miss Veterinarian? And you have to stand by your accreditation parameters that you learned when you became accredited. Any signs of contagious or infectious disease. An animal cannot go to the fair with ringworm. I've heard, and I've been around many other veterinarians in other states, that they say, oh, well, you know, if the lesion's starting to grow back hair and is showing signs of recovering, maybe it's not infectious anymore. I know that gets very into the weeds, and for me, I tend to just err away from that. I try to just find a way to discuss with the owner, because ringworm is not something that can be cured in a few days. It's going to be there for at least a month, if not more, and it could be in the other animals, and it's just not worth taking the risk. And that's going to be a significant part of the fair season there. So you're going to have to be the bad person that day that isn't very popular, but you could save significant amounts of contagious spread and other unhappy families if you're able to put the halt on this and you can get treatment started and see if you can catch the second half of the fair season, or find an alternative animal. So anyway, with this, unlike ORF, with this is a lesion that you can put gloves on and be careful, but you can scrub these lesions. You can scrub ringworm lesions. I use iodine. I've heard of people using diluted bleach. I've heard of people using other disinfectants that are, if they're labeled and able to be used and topically on animals. I use a little aggressive brush on the first day. You can use a wire brush or just a really stiff plastic brush. Be careful when you're scrubbing and brushing this that you don't spritz or aerosolize or spray this in your eyes or on your face. You do have to be careful when you're cleaning this, because this is certainly zoonotic, and I've seen many of my farmers and clients catch ringworm from their heifers or from their sheep or goats, and so you have to be cautious of this. But I scrub this lesion aggressively, allow that betadine or iodine to soak in. I don't even rinse it. I leave that betadine soaking in that lesion after I've scrubbed that crusty surface off, and I leave that in there, and then every couple of days for the first week, I'll just make sure I'm hitting it just 2 or 3 times with that initial disinfection. Then I stop and I let that create a scab and heal. Okay, but you will all develop your own approach to treating this. Some people don't scrub it and they're like, just let it run its course, because it will run its course. It typically takes months to run its course, but I know with scrubbing, you can cut that in half, and scrubbing and disinfecting, and you can actually accelerate the healing rate of that. But you know, it's all up to you and how your approach to this is. But certainly while they're being treated, this animal's not eligible to go anywhere. It should be quarantined from other animals, and it certainly shouldn't go anywhere interacting with the public. So here's just a quick description of what I just said, how I learned to describe it, to scrub and debride it. Here's something I wanted to mention. I showed this picture here in this slide of Blue Coat. I don't know if everybody there can see the Blue Coat can, but I'm showing you this because this is this has deep meaning to me. When I see this can, and you all may have different responses when you see this. Don, I'm sure you and I probably have a similar response. This used to be a very common hallmark treatment of almost every lesion and every possible thing that all farm animals get. And my granddad used it, my dad used it. I even used it when I was a kid. It's an antiviral, antibacterial, antifungal miracle spray that all farmers use for everything. Dehornings, disbuddings, lesions, wounds, scrapes, scratches, everything. Now, I'm here to tell you, and probably you younger generation veterinarians that maybe have graduated in the last 10 years, hopefully you're aware of this. If you're not, I'm here to tell you this, that this spray, this miracle drug, this landmark, hallmark treatment of all farms everywhere is not allowed. It is illegal for use in food animals. Okay, that in 2009, this was, at least when I discovered, this has certain chemicals in it and dyes, and there's a dye in there, gentian violet, that causes rarely, one in thousands, one in 10,000 people, it can cause an aplastic immune response and can cause a significant allergic, essentially, response from these people. And it's been banned from food animal use. Blue coat cannot be used in cattle, sheep, or goats. Okay. Now, that's a problem because this was an excellent treatment for ringworm. I didn't show it to you in my treatment therapy because it's not allowed. I didn't want to get it in your head, but I want you to see this can and recognize this can. This can is still an excellent therapy for, say, horses, not to be used intended for food, or any kind of non-food animal. It does stain your skin. Be careful when you're using it. So you'll see this can in the old medicine cabinet of a lot of farmers out there. And I just want to let you know what that is and the significance of it. And you may see, and I still catch farmers after they disbud their goats or disbud their cows using this. And I'm like, I can't use that anymore. You should use silver spray, the alu spray, or use another product, Vetricin, or some kind of topical wound spray that is, I showed you guys in my very initial slide in the introduction to small ruminant practice, some of the common tools. I showed you a picture of the alu shield, the aluminum spray shield, that I think a lot of you probably have seen before. So try to shift to another, another type of spray. Somebody just popped up a question about, is this okay for use in camelids? If the camelid is not considered a food animal, then I would say anything that is not considered a food animal, you're probably okay. You do have to remember the federal classification of food animals into major and minor species. Okay, so major species are cattle, horses, dogs, cats, turkeys, chickens, and pigs. Those 7 species are major species, and you cannot use this in those. Minor species are everything else: sheep, goats, fish, camelids, captive cervids. Minor species, there are certain X-ray labeled drug use you can get away with in those animals that you can't get away with in the major species. However, it is my knowledge that anything prohibited is not even available for extra label use in any of the major or minor species. So if this is even remotely a food animal, or even a chance of it, and I have 2 alpaca herds here in New Hampshire that raise their alpacas for meat. They sell it, they market it. They have many animals, and they have a food animal production there. That's a food animal for sure. Many of you may just have clients with a pet llama out back that's 15 years old and is certainly never going to be a food animal. That's up to you how you want to approach that. This spray would be effective in those animals. It's just a question of whether your level of risk. And to be official here, I should tell you that any animal should, farm animals potentially used for food or classified as food animals, major or minor species, should not have this spray used, okay? But it's up to you clinically how you want to approach that. But great question. I thought I saw something in there about scarlet oil or red coat. I've seen red coat out there typically used. I've seen it more commonly used in horses. I have not seen red coat or the dye in red coat on the banned list for extra label usage or for food animal products. I really shouldn't quote you that unless I look it up, but you guys will see this product on the shelf at your Tractor Supply Agway. You'll see blue coat, and sometimes you'll see red coat or scarlet oil. And I think, but I hesitate to say this on an official recorded presentation, I think those sprays are okay. I don't think they are banned. I haven't seen them myself on the prohibited list. That's something that you and or I can check with FairAd, or check also on the label. But it's very good you're thinking of that. Every single spray and thing you apply to animals, you should think of that, okay? Okay, so we're getting pretty close, 12:38. Why don't we talk about this one more, and then we'll go to questions. There's obviously many more to cover, but pink eye, very common reason to reject a health certificate. Again, another very common disease, just like ringworm, that you will see in animals coming out of the auction chain. Many small ruminants coming over state lines into Maine and New Hampshire from auctions in Pennsylvania, New Jersey, or further than that. People are very excited and happy to get their new sheep or goat, whether it's a pet or whether they're going to raise it for fair or whatever. But if they come from out of state or if they have an unknown background, certainly, especially lambs and kids, can come up with this pink eye or infectious keratoconjunctivitis. Something you should know: pink eye in small ruminants is different than pink eye a little bit. Is different than pink eye in bovine, large animal. Pink eye in bovine, infectious bovine keratoconjunctivitis, is spread by a vector. Okay, the face fly, Musca autumnalis. And that is by far the major method of spread for pink eye in cattle. Small ruminants, it's different. It's not necessarily spread by vectors. Flies and vectors can spread it, but the primary method of spread in small ruminants is direct contact. So animals that have been just housed together or put through an auction together, or kids that have even been lambs and kids that have been kept together in auction pens or moved, they absolutely are high risk for getting pink eye. Okay, and also another difference is that the bovine IBK, keratoconjunctivitis, bovine pink eye, typically causes a central corneal ulcer in the eye in the center of the cornea. It's very different. That's how it starts. A small ruminant pink eye is a little more traditional that you would see in the other species, in that the entire eye, the margins of the eye, the sclera, everything gets inflamed, and it's not necessarily a punctate ulcer. Definitely a difference in clinical presentation I've seen between bovine and small ruminants. But overall, the organisms are very similar. In small ruminants, they typically tend to be, thank goodness, most of them are tetracycline sensitive organisms, mycoplasma, chlamydia, moraxella, even a couple cases of reported rickettsia. I have not seen that myself. Typically, I see chlamydia, moraxella, and mycoplasma. And those are all tetracycline sensitive. Again, there's no tetracycline product labeled for small ruminants. So if you're going to treat this, even though it's considered standard of care in the veterinary industry, you need to remember that before you use an extra label product on this minor species of food animal, sheep and goats, that you need to dot all your I's and cross your T's that I mentioned earlier. Okay, you have a VCPR, you're willing to label, you're willing to keep records, you're willing to make sure everything's identified, you're willing to give an extended meat and milk withhold, all those things, okay? All right, thank you, Michelle. I see a 5-minute warning. So tetracyclines typically work excellent in small ruminants with pink eye, keratoconjunctivitis, and I tend to use them not only locally with an ointment if the animal's available to be treated locally with an ointment, but systemically. I tend to give them a systemic injection of tetracycline to clear them up, and their mucous membranes clear them up as a carrier, because these animals can be carriers in their other mucous membranes, not just their eyes, for these pathogens. So I typically give them a systemic dose of a long-acting tetracycline, for example, and I will have the owner use a local tetracycline ointment, a terramycin ointment, in the eyes 2-3 times a day for several days. This is a very standard treatment for pink eye and small ruminants. You can have resistant organisms that are not treatable by the tetracyclines, and therefore you may have to do a culture and sensitivity, a swab of this eye lesion, or a swab of the discharge, and look and see if it's sensitive to fluorphenicol or to athermycin or some of the others. All of these would be extra label usage, and you need to be careful and keep records as you bounce between potential treatments, okay? Never use chloramphenicol, gentamicin, or the others that just are certainly not appropriate for food animal use. And there's some images of pink eye, etc. Okay, and then CAE is a very common one. I'm going to actually wrap it up here. And caprine arthritis, encephalitis, and OPP in sheep, a retrovirus, very common. You will all see it. And I'm not going to go through all the slides here. But again, that's something too, again, infectious disease, something that you will get called for as a veterinarian. It can be very tricky because it's often a subclinical disease, an infection that you don't even know. It's typically transmitted vertically from the dam to the kid or to the lamb in colostrum, but it is very, very prevalent. It's another infectious disease that you will see throughout the United States, high prevalence in sheep and goats, and something to keep an eye out. Causes four clinical presentations. So it can present with mastitis or lameness, that kind of thing. And sometimes it can have more than one or multiple different presentations. Encephalitic form is another one, pneumonia, arthritis, and mastitis, like we just discussed. So I'm going to actually, for now, I'm going to wrap it up there. And if everybody Michelle or Carol, I can't see the chat, so I'm sure there were probably some questions that came in from the chat that I didn't catch. So if there's any questions in the chat, if somebody wants to chime in here, thank you, Michelle, for giving up your time to present, to let me go on. Thank you so much. And I'm sorry about the technical difficulties, but I'm very happy at any point, everybody here, to maybe next year have a phase 2. This can be phase 1. I love the cattle topics we discussed, but we also have yet to talk about, yonis, very common, infectious pneumonias, many different types of infectious respiratory disease that is just in itself a whole topic. Lots of other great topics to discover and discuss, but with one session you can't cover everything. So curious if anybody has any questions.
Dave, thank you so much, Dr. Harvey. That was a great presentation, despite all of the hiccups. I'm sorry for the echo, you guys. Let me just try to unmute. I don't know if that's going to solve anything. So why don't you guys unmute yourselves? There were two questions that I noted in the chat, Nathan. I'm not sure that you had an opportunity to answer. And maybe if I just highlight those now, maybe I'll just kick off the Q&A.
Okay. Should yes. I can't see the chat right now. So can you either read them to me, or should I stop sharing, stop presenting, or what do you think is the best way?
Yeah, why don't you stop sharing, and hopefully my echo has gone. And there we go. Okay. So I'll just read those two outstanding questions, at least the ones that I saw. One of them was from Dr. Don McLean, one of our main practitioners. Hi, Don. And he asked, I think it was during the foot rot section, probably when you were talking either about foot baths or other treatments that he asked, why allow, I'm assuming the feet to dry?
Great question.
Don, okay.
Okay, I just did the stop presenting thing. I'm not sure if you can see me or we see you. I can even click in here so people can see me. Okay, I don't know if you can see me. Okay, great question. Why allow the feet to dry? That actually did not come from me. I've seen that in recommendations for foot bath protocols. In my mind, that's a relatively, if you do everything else right, that's a relatively minor concern. I think it might have to do with the type of foot bath you're using. Like if they have the copper sulfate on their feet and they are tracking it, dozens and dozens of sheep at repeated foot baths, it can possibly contaminate pasture with copper. Certainly if it's formalin, keeping them in a contained area, letting it dry, monitoring the animal before it leaves. Sometimes animals can actually lick and try to ingest formalin. That's a good question. It's not super high on my priority, but I have seen that in several protocols to make sure the animal has a few minutes there for it to drip off in a contained area near the foot bath before they go back out onto the pasture you're letting them on. So I don't know, a good question. I'd be willing to brainstorm it with anybody here, but I've seen it repeatedly in protocols.
Thanks, Nate. And then one other one, Dr. Kelsey Hilton, another main practitioner. She was asking about the Fusagard vaccine that you mentioned, and she asked if you're using the cattle version or is there a small ruminant iteration of that vaccine?
That's an awesome question. It's actually been a few years since I've used it. I thought it was I think it's the cattle vaccine. I don't know that there's a small ruminant specific one. Actually, let me, trying to think if I have, I'm trying to think if I have that. I can actually get back to you on that, Kelsey. That's a good question. Most of these vaccines that we talk about, a lot of them are cattle vaccines, or even, they're used extra labelly. The one I had been using in my internship and residency, which I mentioned, haven't done for a while, it was a cattle vaccine. That I know of, I don't believe it's a sheep and goat specific vaccine. I can certainly check that out. But again, for me personally, it's been probably over 10 years since I have actually had to do that. I have had to use a foot rot vaccine. So kind of hoping to keep that going. Good question, Kels. And I can actually, I can email you back if you want to put your email in the chat, or email me later because you have my contact info. Good question.
Okay, Nate, that's all that I could see in the chat that you hadn't gotten to yet. So I'm just going to encourage folks, try to make this as much of a dialogue as we can. You can turn on your camera if you wish. unmute yourself and just fire your questions at Dr. Harvey.
In the meantime, anybody out there, if you have had, anybody out there that's had sheep and goat flocks, I saw that several of you have a lot of experience with sheep and goats and work on them regularly. I'd be curious if you, your approaches when you guys are presented with sheep and goats with caseous lymphadenitis, which to me is it's a disease that really is the first three diseases I told you about are very challenging, and people want a quick cure and they just want you to give them the right pill or the right shot for curing it. But certainly with CL, that's not the case at all. And with foot rot, that takes months of recovery and planning, and with ORF, that is a permanently contaminated environment. So I do struggle with these pathogens when they're become endemic in a flock or herd. So I'm curious if any of you have had any of those situations, and if you have a unique approach of your own. I'd love to hear it. I learned actually a lot of what I learned from comes from people I present to, and you all too. So I'm jotting down the notes. I saw Kelsey gave her contact info.
Nate, I have a quick question about whether or not ORF or contagious ichthymia is reportable in New Hampshire, and if it is, immediate or monthly reportable.
I'll grab it right here. It's not New Hampshire. I'm not sure how Maine is, but we're, as you know, we're all going through the the national list of reportable animal diseases has been modified, and we're all of our state worlds are going to change here soon when we kind of shift to that. I think our state is even a little bit unique from your state in that we have a list of purely state reportable diseases, and we know that of course the national list is out there, but this list of diseases that we have, I should have scanned this and shown it to you. It's really a historical walk through the diseases of America since the 1700s. And some of them I've never even heard of or aren't even around anymore, but since laws were made in New Hampshire. But ORF or a sore mouth, it's not on as a disease, it's not on a reportable list. When we reports about it, it's when it's showing a presentation that makes a clinician nervous about other reportable diseases, either vesicular or something like that. So here in New Hampshire, even strangles in horses is not reportable. Parvovirus in dogs is not reportable. A lot of the more modern reportable diseases that in many states are reportable. It's not here. We do appreciate when the vets call us. We always appreciate when they call us. But just because it's not on our specific state list doesn't mean you can't contact us. But no, ORF is not on ours. Is it specifically for reportable in Maine, or?
It's on our immediately reportable list for sheep and goats, and I think that a lot of practitioners are surprised to learn that, as are producers, because producers have seen it for years. They know it's here, and I have thought about delisting it, frankly, because it is so common. I have seen some pretty impacted herds, the young stock, just really animals who you think actually may not make it, as you said. And it's pretty devastating when somebody has a naive flock, and it's usually they've bought in an infected animal. And the source flock has no sympathy. That's what we have found, is that they just, they're like, it's just part of it. It's better for them to get exposed. It's sort of like chicken pox in kids. That's the attitude. So anyways, I don't want to hog the time here, but I was kind of curious. So still reportable in Maine for any of our Maine practitioners, or if you have Maine clients. And we do the follow-up, and we actually pay for the testing for ORF to confirm the disease, and we do the molecular test. So, certainly reach out to us. I actually have a flock right now that I have to get back to, but.
Just for the group, I don't know if this is still accurate information, but when I was in Pennsylvania, ORF was not reportable. It's so present there, and they have a lot of major auctions, and ORF is not reportable, but you're still expected to kind of work through it and contain it. But when you run the virus isolation test and send it to a regional diagnostic lab, it's an expensive test. I mean, it's not like serology where you can get a whole bunch of samples for just a few dollars each, or not even. When I used to run the virus isolation test, I think it was like $60 for one sample for a true virus isolation if they wanted to identify it. You could send in the scabs, the crusts, or you could actually swab a lesion. Maybe that's probably gone down now, possibly, but even if you're a veterinarian and you're doing this privately because it's not reportable, you would also typically mark up your fees a little bit just to cover your time and services and mailing fees and stuff. So for a person to test their sheep or goat could be 70, 80, $90. So it wasn't to be taken lightly. So, oh, looks like a question. Is Q fever? I just saw my questions flash up here. And I think I saw Q fever. Is it still endemic? I couldn't see if it said in our state or across the country. Did you see the chat pop up there? A question about Q fever, Coxiella.
Yep, I can
That's,
read that to you, Nate. So is Q fever still endemic in most flocks of sheep and goats?
yeah, that's a very good question. I have a whole nother lecture on all the toxoplasma, Q fever, brucellosis, leptospirosis, and all the reproductive diseases. Q fever is very common. Gosh, I wish I had a number for you in front of me, how incidence rates. But it is still remains, Q fever remains your number one, certainly your top three, or in many places your number one differential for when you're dealing with an outbreak or a abortion storm or something like that in small ruminants. So endemic, I can't answer that off the top of my head, but it is very common and it is considered a high differential. And yes, it's still very clinically relevant, if that's your question. That's a good question. Yeah. And anybody here, as I mentioned earlier, when you're in small ruminant practice, dystocias and reproductive management is going to be a part of, unless they're backyard pets that are not being bred, but in almost all flocks and herds that are on any kind of level of production, even fairs and exhibition, you're going to get called for dystocias, and you're going to get called for occasional abortions and aborted fetuses, early embryonic deaths, and stillborns. And jumping on that as quickly as possible, to me, is always the key. I always find that clients call me when they've already had one, two, maybe on the third stillborn or abortion. They'll call me and I'll say, "Oh, do you still have the fetus and like the placenta?" And they're like, "Oh, 2 days ago I threw it in the back, compost pile or something." I'm like, the first thing I tell all my dairy herds and small ruminant flocks is that even on that, there is always a normal rate of endemic loss that happens of pregnancy. But anything beyond just one, even, just grab it and call me first before you throw it away. Let's talk about it, that animal, the risk factors. I can even just go through it with you and decide if it sounds risky before you ditch, because the placenta or the fetus are your key elements to getting started on an abortion outbreak. Particularly Q fever would be a perfect example. Good question.
Nate, can you see from Dr. Karen Kakzarowski, I think is how you pronounce it. She says, this is a great question. How do we encourage clients to isolate newcomers and be more aware of farm biosecurity? She said, I feel I need to scare some of them, especially lately with irritating chronic coughs. So I didn't know if you had any recommendations for Dr. Karen.
It's such a good question. That is an awesome question. I wish I knew. It's the bane of my existence is getting people. It's true in equine, it's true in cattle, it's all livestock people. It's like I just had a client, it's equine, and they shipped a very expensive animal in and just dropped this 8-month-old yearling in with all the others. And I'm like, and this is a smart person too. And I'm like, she's like, well, he came from a small place and not exposed to a lot of animals. I'm like, I don't care if he was by himself and born in a bubble. Like, you just isolate them. And it's such a good question. I mean, just knowledge and education and that interaction with them. Honestly, sometimes I hate to say it, but it takes a mistake or an outbreak for them to have it really sink in. I have a bunch of beef client herds. This is unrelated, but it's related. Many of my beef client herds castrate and do things, and sheep and goats, and they don't vaccinate for tetanus. And we can talk about tetanus in another time. But castrating, banding tails, banding testicles, banding navels, that is the single most common cause of tetanus in livestock in the United States. And I have so many clients that don't do it because it's just, after a while, they haven't seen an animal with tetanus and they think they're good. And then I'll have this epic disaster. Well, they'll have a few tetanus cases and they're almost always fatal. And then they vaccinate again forever because it's like they saw it. It's like they have to see it to feel that. And that's a really excellent question. It's at the heart of all of our vaccine programs and our initiations to try to prevent disease, education, sharing examples anonymously of other places that you know, be professional and diplomatic about it, completely, protect people's information. But if I had another herd years ago that took a risk and brought animals in, I'll tell them an example of that. I don't tell them who or where, but I wish we all knew how to truly get clients to do that. And I think, like you said, sometimes it has to burn them before they get it. But in educational information, pamphlets, handouts, your knowledge and expertise, that's all part of it. Prevention program.
Nate, thank you so much. I am going to just jump in here, and I just have a real quick announcement for our Maine veterinarians or Maine or vets anywhere who have Maine-based clients. One thing I might mention about a resource for good farm biosecurity advice, handouts, all that kind of stuff is the UVM, University of Vermont's. If you Google University of Vermont Farm Biosecurity, they have an excellent website with lots of great resources. Dr. Julie Smith has been doing lots of work on farm biosecurity, and actually she's working with all the state animal health officials in New England right now to sort of beef up our outreach, education, and training efforts to that end as well. So just a little plug for her there. And Nate, again, thank you so much. You did an excellent job. And if any of you Maine vets can just stick around for another 2 minutes, I'm just going to do this quick announcements. I think you guys can see my slide. Nate, can you see my slide?
Yep, I see it. MeCHAP Veterinary CE webinar.
Yep. So our next MeCHAP webinar will be next month to round out 2021, offering another 2 free CE credits, and it's going to feature large ruminants this time. So back to the cows. Dr. Glenda Pereira is going to be our primary speaker. She is the brand new dairy specialist extension agent at University of Maine. We're thrilled to have her. She's actually from the Azores, from a dairy farming family. She's going to talk a little bit about her research at University of Minnesota that focuses on precision dairy technologies, but I think she's really interested in sort of getting to know practitioners and finding out what the needs are for education, outreach, for your clients as well. So I think that'll be a really great session. I'm going to talk about reportable diseases next month. Never a bad time to talk about reportable diseases, Nate, so we can just delay that one. And if anybody has questions in the meantime ever about reportable animal diseases, if you see something, say something, call my office and have a conversation with us about it. And I'm sure Nate feels the same way in New Hampshire. If you have Maine clients and they own cattle that are potential breeding animals, there are free RFID tags, which are radio frequency ID tags, the little button tags that usually start with 840, which means born in the USA, official ID tags. They're available for free now in a lot of the New England states. If for more details, I'm going to have you just call our ADT technician, Donna Flint, at that number on the screen. It's 207-557-4623, 557-4623. There are some hoops you have to jump through, frankly, but they're definitely worth it if people don't want to be paying for those tags. At least get them started with some free ones. And then a public service announcement. I was contacted lately. It's about the 3rd time in 9 years that I've been contacted by the U.S. Fish and Wildlife Service. Currently they're investigating some bald eagle deaths, and the tox panel that they run on those animals or those carcasses has come back positive for phenobarbital and phenytoin. And so most likely this animal fed on a carcass of an animal who was euthanized with euthanasia solution. Like I said, it's only the 3rd time in 9 years, but that's 3 times too many. So I just want to remind everybody just to be really mindful that actually, even if you euthanize a large animal and then it's dragged out in the back 40 of your client's property, you are actually held responsible by the federal government for the death of that migratory bird or protected animal, like the bald eagles and the golden eagles. So they do thorough investigations. So I just feel like as a practitioner, I guess it just bears repeating. Just be really mindful of that. Even if you had nothing to do with it, you told your client to, compost the animal and they just didn't get to it. Just it bears repeating to your clients as well, or for you to take total control over the disposal of that animal.